99070700949 plus 919907.
Just like put it in search, finish the MCQs, with the way our preparation is so we don't have hope. It's also easy. That's what we say. Previously tried.
సురేష్ లింక్ వేసినామా కొంచెము ఇదే ఇప్పుడు క్లాస్ది లింక్ అన్నట్లు
And I see Instagram and feeling more depression. शादी के बाद चल रहा है 24 मुझे नहीं फर्क पड़ना चाहिए, but I feel so hopeless when it comes to my profession and my personal life. I'm like, where am I? What am I doing? If somebody's getting mad, I don't like to be part of the pity party. I don't like this pity looks. I'm like smiling. Don't allow me to affect you in any way. I'm sick of going to shite. I'm sick of being a part of the dance. I don't know what to do this. Neat. Even I took the stairs. I was feeling very uncomfortable.
6:45 to
Sorry, 20 people?
Same. I actually came on our way to that. We were not feeling well. Both in the trial and the video better. This deadline speaking. So, at 12 o'clock, they were alarm बजा रहा हूँ उनको as usual. They usual getting up at when I wake up at 2:50.
I forced myself to sleep early. सुबह आवा का था. We had good tempo. Unfortunately, I had like company my dad is the worst company person. Even if you're taking good, you're not people to move down. Just that kind of person.
What daddy?
Yeah. Just couple of days of comfort.
You are the elder daughter of CA.
And once I feel why isn't this pressure beyond the other one? And how about test? Anything which we come out there, like they only call me, they only repeat my system. She's absolutely free. And go back and away. Right there, I'm the bride is here. So she don't make the fiance's care. Trying to formalize it. I didn't go into details. My sister's this thing. She left me already, 19.
She was actually supposed to leave for the star, but Ali emailed us from college saying he ended a bit 30 years there. Ended it. Next
You have to go to doctor. I think Bangalore also there. Competition का भी कोई tension नहीं.
अकेली है वहाँ पे. हम घर के सामान सब पूरा लेके सब ऑफिस में जाना.
Second था.
नीचे 5 किलो से 3 गाड़ियाँ उसमें से एक मेरा.
I was feeling a bit depressed about not having engagement. It is wonderful.
तो रात में नहीं होगा उसमें क्लास.
नहीं. Also one. Also. Wait, I think slide was it. The Diwali of 60 every as subject matter questions. I think Sally finished as a touch conclusion. So, can you be something like that? हाँ 27 is nice.
सुबह में 11 बजे होता है.
हाँ बजे 5 बजे तक है शाम को. I'm just waiting for the correction to do.
30 से correction.
नहीं एग्जाम के पूरे दिन पहले just few days पहले they give you correction उसके बाद ही
In February 12th, there is one correction. I don't know what. There is one correction starting 28th.
it's official.
So they are issuing notification.
We got a mail about it. I filed a complaint saying that SSM है इसको ऐसे से change करना है.
Good evening, everyone, and welcome to today's wonderful evening with Dr. Murli Bharadwaj. 38 days more before the World War. So, we fight on the land, we fight on the sea, we fight in the air to end the beast. So, we need to be very sure to have that kind of defiance to defeat and magnanimous with victory. That kind of a spirit, indomitable spirit to win. To win, most important thing in life is, doctor, to believe in oneself that I am going to win. Throughout my journey in life, in the last 49 years, many moments of shame, many moments of fall, many moments where I have to tuck my face in the pillow and cry, why this happened, right? But the point is, every time we were researching, that is whole spirit of life, right? फन क्या होता है अगर नहीं गिरे तो? सो जिंदगी के सबसे बड़ी चीज नहीं गिरने में नहीं, मगर गिरकर हर दफा उठने में है, right? So with that spirit, let us work together, let us improve together, few steps every day. So very nice to see our ring leader Vinisha and the gang leader Diksha and class leader Mithuna and the handsome hunk Raghuvaran. Good. So nice to see Meghana, Mitali, Marksman, Shweta, and many more who are all online. Yes, doctor. Huh? We'll definitely discuss yesterday paper, daily paper, tomorrow paper also. No worries. We'll do. So, doctor, what is the appearance on the renal angiogram, which is very classical? Fibromuscular dysplasia. Okay. Good to see Kushi and many more. Fibromuscular dysplasia. What is this appearance called? Beads of string appearance. What is the importance of fibromuscular dysplasia? The most common cause of the renal artery stenosis in young females typically is fibromuscular dysplasia, whereas the most common cause of renal artery stenosis in old is atherosclerosis. And both of them, whenever renal stenosis is there, will present with hypertension, is what you need to remember. Good. Now, doctor, appearance on the MRI, what does this suggest? Cavernous angioma. It's called popcorn appearance. Is cavernous angioma. Appearance in this figure is diagnostic of. It is superior sagittal sinus thrombosis. What do you see here? Delta sign, empty delta sign, this is called as. So these are all very classical questions, doctor. Now, What is the investigation of choice for this condition? So this is called Sylvian fissure. Normally you don't find blood in the Sylvian fissure. अगर Sylvian fissure में blood हो तो इसका मतलब है subarachnoid hemorrhage is what you need to remember. How do you identify this? You have to do a non-contrast CT. Non-contrast CT is what you need to remember. So what is the investigation of choice for this condition in a 64-year-old man presenting with deafness? तो वो क्या है? Acoustic neuroma, gadolinium enhanced MRI, contrast enhanced MRI is the investigation. This is associated with skull vault, which is being shown in this figure. So what is this? This is fibrous dysplasia. Fibrous dysplasia. अगर fibrous dysplasia long bone femur में हो गया तो what appearance you get? Shepherd crook appearance is what you need to remember. Good. Very nice to see 17 online classmates. 36-year-old Iraqi woman with long-standing iron deficiency, hemoglobin level 8.2, ferritin is 7.1, barium esophagogram is being done. Immediately, what will you jump to? Esophageal web, koilonychia, Plummer-Vinson, and they are at the risk of developing actually squamous, no?
So webs are up. So
Huh?
using false statements.
False in the. Which are the following? False. Okay. Increased risk of squamous cell carcinoma, mechanical dilatation can be used, and most patients are middle-aged women. 54-year-old with thyroid mass, FNAC. You are saying these lesions in thyroid. So monomorphous cell population of Hurtl cells, which are loosely cohesive clusters and single cells. Hurtl cell carcinoma. This is the Hurtl cells. So one is orphanine cells in papillary carcinoma. Thyroid cancer, chadavandi. Thyroid carcinoma, pado. Right? Nice to find Shweta. Excellent. Shweta regularly participates in discussion in group. Always for a teacher, somebody who reacts. Diksha also used to react. Nowadays, you are not reacting. 2 days I was absent. So keep asking questions. Keep asking. Even clinical practice questions पूछो मुझे. क्योंकि मेरे पास चैट जीपीटी है. 2 मिनट में हम डिटेल्ड एक्सप्लेनेशन दे देंगे. Very specifically. Today one student asked, "Sir, what is the indomethacin dose for treating arthritis?" मैंने चैट जीपीटी को बोला कितना है. वो बोल दिया मुझे 25 to 50 milligrams. मैंने डाल दिया. उसने बोला thank you so much sir, you are so knowledgeable, available always. Chat GPT is available anytime. So please ask the questions. We will give you the answers. Right? So doctor. Excellent Shweta. Papillary carcinoma, samoma body. You need to remember. Now, indolent and non-aggressive is never the nature of Hurtl cell tumor. It is more aggressive. It does not take up radioactive iodine. If they are diagnosed on FNAB, they need to undergo lobectomy and hystemectomy. And for tumors more than 5, total thyroidectomy is often performed, is what you need to remember. अभी आ गया पूरा pelvis का शेपा, android, anthropoid, gynecoid, platypelloid. So, what is the correct match between the two? So, B favors oblique occipito-posterior position. So, B is what, doctor? Android pelvis is the one which promotes the occipito-posterior position. Now, anthropoid pelvis, direct occipito-posterior position. Platypelloid favors transverse position of the occiput is what you need to remember. Excellent, doctor. 20 online classmates. So now, what is wrong about the placenta which is being shown? So first of all, what is that? It is called circumvallate placenta, where the membranes double back for a short distance over the fetal surface. Circumvallate placenta. Circumvallate placenta lead to antepartum hemorrhage. Older multiparas are more prone. It leads to LBW babies because the decreased blood flow. Placental perfusion decreases because of it. 29-year-old woman with the history of infertility followed by history of recurrent pregnancy loss. She has a low luteal progesterone level, treated with 50 mg of clomiphene citrate. Pregnancy resulted in a spontaneous abortion 5 weeks later. Again, she conceived and had a spontaneous abortion, and her histogram is being shown to you. So remember, doctor, Mullerian abnormalities. How septate uterus looks like, how uterus didelphys looks like, how do you differentiate between the didelphys and septate uterus in hysterosalpingogram, which type of Mullerian abnormality prevents pregnancy, permits pregnancy but abortion, permits pregnancy, no abortion but low birth weight. All these are possible. So patients can conceive. A patient who has got a septate uterus does not usually have difficulty to conceive. यूं conception हो जाता, मगर there is a high rate of pregnancy loss out of all the Mullerian abnormalities, and this is a septate uterus is what you need to remember. Is the gross గుమ్మడికాయ కాదు, ఇది గుమ్మడికాయ కాదు, ఏం కాయ ఇది? Ovarian mass. Gross appearance of ovarian mass. ఇప్పుడు చెప్పాలి. What are these cells called? C for A for Paul Exner's bodies, doctor. ఇదొకటి, తర్వాత ఇంకేముంటాయి? సామోమా బాడీస్. ఇంకా ఒవేరియన్ ట్యూమర్లో ఇంకేమేమి ఉంటాయి? ఎండోడర్మల్ సైనస్ ట్యూమర్లో what is very classical of endodermal sinus tumor? Ovarian tumor panna hai bhai, please go to the score NeetPG app, go to search, type it and then revise it. All right. So granular cell tumor is known for very high estrogen production. That's the reason it leads to endometrial adenocarcinoma. It leads to a pelvic mass, and the primary treatment to the patients is fundamentally surgical, is what you need to emphatically remember. Very good. Now, doctor, one question on pedigree तो जरूर आएगा, आप उसको पकड़ना पड़ेगा. What is this inheritance pattern? AR or AD? ఇది ఏమి పెడిగ్రీ? Pedigree is showing unaffected offspring, carrier offspring, and affected offspring in a family with a autosomal recessive. Unaffected means, let us say A. Carrier is A small a. Affected is small a small a. All the three are there. So now, doctor, this patient doesn't have axillary pubic hair. So what is this condition fundamentally? The newborn with streak ovary often shows edema of the hands and feet. So she's also having what? Webbing, Turner, and widely spaced nipples. So typically there are short stature, estrogen levels are low, newborn shows edema of the hand and the feet. Then if the estrogen is not there, maturation index and other vaginal sphere indices will be shifting to left. So depending upon the cornification, there's a cornification index now. That's what the examiner is asking. So now what do you have? Clitoromegaly. So whenever clitoromegaly is there, both ovary and testis are found in internal genitalia. So what is wrong about their diagnosis? Congenital little hyperplasia is a clinical differential diagnosis whenever somebody presents with clitoromegaly. So whenever all these developmental anomalies of the sexual development, they must be rare as females, almost all develop female type of breasts. So it is a true hermaphroditism. Nowadays, this terminology is all changed. When both ovarian testicular tissue is present. So the Y chromosome carries the material needed for testicular, and this material is active even if multiple X chromosomes are present. Men are men even if they are influenced by multiple women. So X chromosome जितना भी हो, अगर Y chromosome है तो clitoromegaly हो जाएगा. Right? So, doctor. So what do we see here? Typically, clitoromegaly once more. So typically, clitoromegaly is a feature of 21 alpha hydroxylase. So और एक बार आप चार्ट डाल दीजिए जनाब. एल्डोस्टेरॉन होता, टेस्टोस्टेरॉन होता 21, 17, 11. 1 कहाँ है? टी में, तो इसलिए टी है ए डाउन, एल्डोस्टेरॉन लो इन 21 अल्फा हाइड्रोक्सिलेज. 17 में 1 कहाँ है? पहला है, सो एल्डोस्टेरॉन इज हाई, टेस्टोस्टेरॉन इज लो. 11 बोले तो दोनों हाई है. 11. What is not 11? Why not this is not 11? Possible. Yeah, you're right. Because even there also you have the high testosterone levels, na? Agree. But most common is 21 alpha hydroxylase. वो याद रखना. So there's a normal cycle 14th day. This is mid-luteal, and then you have so the pattern formed when cervical mucus is smeared on the slide labeled A, represents progesterone. Progesterone. PCOD la hyperestrogenism unte thickness perute kada. Proliferative will be very high. When cervical smear permitted to dry and examined under microscope, Progesterone makes the mucus thick. In the smear shown who failed to ovulate, there is no progesterone to inhibit the estrogen-induced Parn pattern is what you need to remember. Now you are being shown drug A. So, what is the drug A which is being shown to you? When you start the drug, there is an initial agonistic phase, later on there is an antagonistic phase if you are giving it continuously. So that means it is a gonadotropin releasing hormone which is leuprolin. Now you are being shown a parameter which is increasing till 20th week and after that remaining plateau in pregnancy. So what is that? Cardiac output has that kind of characteristic. Very good, Shweta. Salt caving के साथ होता है 21 because it is salt losing. Right? Very good. When the online students can punch, the voice is loud and clear for all of you, doctor. So now, doctor, so this is one thing that you need to know. What happens to the total peripheral resistance during pregnancy as the weeks progress? Typically, total peripheral resistance always comes down. Then systolic pressure typically will show a curve like this. It is lowest during 30th week. Diastolic pressure will show more curve like this by the time 33, 34th week. From then onwards, it starts rising. Now you are being shown alpha chain, then C chain, B chain, epsilon chain, D chain throughout the pregnancy. So which is zeta chain? A. Very good. A is zeta chain. So doctor, artery. So that is all about the image based questions. अभी तो हम फटाफट रॉकेट के जैसे आगे बढ़ेंगे. Vinisha, have you reviewed the questions I posted for you? Audio. Pakka? Good. I decided that every day I will not do anything. सुबह 6 बजे से शुरू करता हूँ. Every घंटा एक 10 questions मार के. Throughout the day until midnight, 12 o'clock. Next 30 days, 35 days. Please read. and you are looking very bright, confident, intellectually malignant, right? So please be the ringleader to inspire everybody. Don't talk, don't tell that my mother-in-law came, my father-in-law came. No, now everybody is confident. 1 crore seat मारने वाला है विनीशा, 1 करोड़ कमा के दे रहे हैं एडवांस में. 1 करोड़ नहीं, 2 करोड़ का है MD pediatric seat.
MD radiology, one of my friends tried to take it himself in the last housing. It was 2.5.
2.5 crores, huh? At least will you pay another 2,000 rupees after you? No. Vinisha, will you pay another 2,000 rupees after you get seat? Don't tell you will take 12 installments to pay. Huh? One of the students today sent a WhatsApp to me. Sir, is it believable that you are giving 40,000 questions and notes and video library, everything for just 2,000 rupees? Yes. Can I really trust and pay? अरे प्लीज पे. ये क्या है? अच्छा, हम अच्छा करने के लिए आगे बढ़े तो people are no more believing. But today, a huge volley of students have joined. Once we said 2,000, everything is available. So good, doctor. But we will give the real value to money. Ultimately, get the seat. That is important.
I just checked, sir, Instagram. Maro or prepladder only, sir. I don't know. 68,000 we cut chesi, 41,000 change. Republic they offer and better. I'm like 41,000 what? I mean, that costly, sir.
The question is not that of cost. The question is the value is not in the score app anymore. The value is in Murli Bharadwaj, who is available 24x7 for anything you want. Right? That is important. I'm selling myself for 2,000 bucks. Mera 2,000 और कमरे का 1,000. Now, doctor, long bone showing looping pattern during the growth of the bone, metaphyseal part, metaphyseal arteries. Sternoclavicular joint is a saddle type of joint. All types of joints you need to read. Which nerve pierces the pronate arteries? Median nerve. Facial nerve supplies which muscles except? Posterior belly is 7th. Anterior belly is by your mylohyoid, that is 5th cranial nerve. Correct? Which structure passes to jugular foramen except facial nerve does not pass? Cerebral blood flow, what is except about it? Oxygen consumption of the gray matter is higher. White is only myelin, which has a high consumption. Out of the total 50 ml of oxygen consumption, gray matter uses 40 to 45 ml. At rest, brain receives 13 to 15% of cardiac output, 750 ml. When the CNS sends weak signal to contract a muscle, the smaller motor neurons get excited first because smaller motor neurons are more excitable. Once more, BAC, hypoxia, right? The most important receptor detection of joint angulation is muscle spindle. Once more, Golgi tendon organ, muscle spindle. When you do Bharatanatyam, where is your hand going will be seen by muscle spindle. Right? Now, the impulse transmission in the dorsal column medial lemniscus system is very accurate in gradation of intensity. For example, is it touch, is it deep touch or very deep touch, or how is the vibration, slight vibration, more vibration? Everything is medial lemniscal system. It can identify 100 gradations of strength. Understand? Pain and temperature does not have that much grade. Pain is pain. It's not it's a happy pain. orgasmic pain, कुछ भी नहीं है. Pain बोले तो pain है. Now, which carbohydrate is present in glycoprotein? N-acetyl nuraminic acid. Allosterically regulated enzyme in glycolysis pathway is hexokinase, phosphofructokinase, and pyruvate kinase is what you need to remember. Wow, nice to see 20 online students sitting in the Shatabdi Express called Murli Bharadwaj. So let me once more tell to all of you, doctors, wherever logic is needed, we will discuss. Wherever it is not needed, we will run through. Ultimate idea is solving every day 200 questions and becoming better. सुबह 10 बजे होते ही एक नया क्वेश्चन पेपर आ जाएगा, छाप, like morning newspaper, whether you read it or not, it will come. So like that, we will give a question paper in the morning, but you need to solve it and come to discussion. Then you will enjoy this more. Glue, folate deficiency. Formimino-glutamate is found from histidine metabolism. So formimino group is removed by tetrahydrofolate to produce N5-formimino tetrahydrofolate is what you need to remember. 7-year-old brought to hospital, hypoglycemia after fasting, lactic aciduria, hyperlipidemia, hyperuricemia. Gout and inkeve. See, the answer is one girk. Then pyruvate carboxylase is activated by acetyl CoA. So what is the function of pyruvate carboxylase? Converts acetyl CoA into it is activated by acetyl CoA. It converts what into what? Pyruvate बोले तो कितना कार्बन्स रहता? 2. Oxaloacetate has 3. So pyruvate to oxaloacetate is what you need to remember. Okay. Now, doctor, all these are properties of IgE. It is homocytotropic, heat sensitive, it cannot cross placenta. Fixing complement is a function of IgM. మళ్ళా ఒక్క క్వశ్చన్ ఇమ్యూనోగ్లోబులిన్లో వస్తుంది అధ్యక్ష, తప్పు పెట్టినంటే ఖతమే. జస్ట్ గేమ్డ్ IgG, IgM, MED. Everything about which is biggest of all, IgG. G is great. IgG. Right? Which is pentavalent? M. Okay. So which is a tube agglutination test? Vidal test is tube agglutination. Complement fixation is a part of type 2. Type 3 actually. Type 3. Immune complex conditions में hypocomplementemia occur. ఇది 3 చేసుకోండి 2 నుంచి. Which interleukin is used for treating cancer? Monoclonal. IL-2. Interleukin 2 is aldesleukin to treat skin melanomas and kidney cancers. Non-lactose fermenting colonies on McConkey. Except Klebsiella. So once more, non-fermenters, late fermenters and fermenters of lactose on McConkey. పూరా గ్రామ్ నెగటివ్ క్లాసిఫికేషను, గ్రామ్ పాజిటివ్ క్లాసిఫికేషను, ఈ చెత్త చెదారం ఉంటాయి కదా, పాసిట్రేషన్ సెన్సిటివిటీ, నోవోబయాసిడ్ సెన్సిటివిటీ, వోక్స్ ప్రోస్కోయర్స్ రియాక్షన్, అన్నీ జర కొంచెము చెప్పాలి. లాస్ట్ 38 ఇవాళ తారీఖు ఎంత? 27. 28, 29, 30, 31. 4 + 28 + 4. 4, 4, 8 plus 28, 36. Who is going to come and study with me next 36 days? Good. Right? So 30 days shall. One nice thing your friend said, I really liked it. What's her name? Anam. Sir, मैं MBBS फाइनल ईयर एग्जाम के पहला दिन 2 दिन में एक सब्जेक्ट रिवाइज करके एग्जाम में अच्छा स्कोर आ गया. उस दिनों में अगर मैं वैसा कर सके तो अभी क्यों नहीं करूंगा. एंड योर नोट्स इज गुड इनफ दैट 30 पेजेस 20 पेजेस में आप खत्म कर रहे हैं स्टोरी को. I don't want to do anything. I just want to finish one subject one day, next 20 days. That is the spirit. Right? So, how do you crash the subject in shortest time is everything. Right? So, give me a break. Don't say 3,000 pages is medicine. Say goodbye to all those coaching programs which give 3,000 pages notes, sent as a big ton. Like a refrigerator, it will come to the home study material. मर जाते उसको पढ़ के. कम पढ़ के 30 दिन में 30 रैंक कैसे आना बताइए डॉक्टर साहब. हमारे पास है वो औषध. So oxidase negative bacteria is E. coli. Drugs which are highly bound to albumin, they can't leave the plasma. So their volume of distribution is less. Daughters who are highly attached to daddy, they don't go out to party. So their volume of distribution is very less. So Mithuna, you have a high VD or low VD. Until MBBS is over, I am happy in the hostel. Nowadays, 2 albumin bound. Don't worry, you will overcome all, you will be out of all that. A subject in whom the renal clearance of inulin is 120. If a given is drug, the clearance of which is found to be 18 ml per minute. If the drug is 40% plasma protein bound, how much is filtered drug must be reabsorbed in the renal tubule? Simple concept है यार. क्लियरेंस क्या होता है? प्लाज्मा से निकल के यूरिन में कितना निकल के जाएगा, that's called निकलरेंस, क्लियरेंस, राइट? तो इसका मतलब 18 ml सीरम से निकल के यूरिन में जा रहे. So clearance is equal to filtration fraction into GFR. The drug is 40% protein bound, so filtration fraction is 60%. So 120 ml per minute into 60% is 72 ml per minute theoretically. Since only 18 ml is being cleared instead of 72, उसका मतलब क्या है? 54 ml is reabsorbed. Understand, doctor? So what is going to come in tomorrow's NeetPG? Sure shot question. Volume of distribution, T half, first order, second order kinetics, zero order, first order kinetics, bioavailability, steady state concentration. It is Harvandi Tallo. Please do revise in Score NeetPG app. At 6 hours after IV administration of the drug, the plasma level is 5 milligram per liter. If the VD is 10 liters and elimination half-life is 3 hours, what was the dose given? Once more, how do you interpret this? 6 hours after IV injection, plasma level is 5 milligram per liter. So if you go back, for each half-life, at 0 time, how much it is? 5 mg per ml per liter into 2 into 2. right? See, after 6 hours, right? Elimination half-life is how much? 3 hours. So that means 2 half-lives. So 5 कितना था हाफ लाइफ, 1 हाफ लाइफ के पहले 10 था, 10 के पहले कितना था 20 था, तो इसलिए आपको कितना हो गया 20 मिल गया जो ओरिजिनल कॉन्सेंट्रेशन है. सो what is dose administered? At 0 point, what was the concentration into volume of distribution? इसलिए 20 into 10 liters, that became 200 mg. These are very fixed questions in pharmacokinetics, right? Maximum 10 models will be there, like in our physics days. All models are fixed.
Now, calculations are not given.
Huh?
Calculations are not there.
What is not given? Who said calculations are not given?
The calculations are not there. Because they're not giving you a paper, it's very difficult to calculate and then they're passing the papers in the.
Who said difficult? You మంచిగానే ఉన్నావు వినీష్, నీకు డిఫికల్ట్ అయితే అందరికి డిఫికల్టా? మా ఆంధ్ర మెడికల్ కాలేజ్లో గీత విల్ నాట్ అగ్రీ, సునీత విల్ నాట్ అగ్రీ, రైట్? సో మా వాళ్ళు చాలా ఇట్లా ఇట్లా చూడగానే లెక్కలు చెప్తారు, లెక్కలు బాగా వస్తాయి కదా ఆంధ్ర మెడికల్ కాలేజ్లో వచ్చేది సీటు. సో ఎందుకు ఇవ్వరు? మస్తుగా ఇస్తారు. ఎక్కడ ఉన్నదా రూల్ అట్లా? We'll ask ChatGPT. Alpha-1 agonists cause reflex bradycardia, which can be blocked by atropine. See, if you give alpha agonist, what will happen? Alpha-1 will lead to vasoconstriction. Vasoconstriction lead to increased pressure. That initiates baroreceptor reflex. And in turn, medulla will send vagus and make it to act on heart, and that lead to bradycardia. So to antagonize, you need to give anticholinergic, parasympatholytic, which is atropine. Clear? Before an eye exam, patient was given a drug that caused mydriasis but has no effect on accommodation. So that is what phenylephrine. So mydriasis can be caused by 2 kinds of drugs. What? Either parasympatholytics or sympathomimetics. So phenylephrine is one such. If it is any parasympathetic drug, it will affect ciliary body and accommodation, but this won't affect. Clear? Outpatient prophylaxis of patient on SVT. We give calcium channel blocker like diltiazem. For the OP management, which disease cause predominantly tubulointerstitial involvement? Sjogren. So what is Sjogren? It will have rheumatoid arthritis-like features plus parotid gland, salivary glands. Everything is destroyed by the lymphocytic infiltration. That's the reason they have a dry mouth. Sjogren's patients. Tears don't come, lacrimals are affected. Because of the dry mouth, they develop dental caries. Because of the dry mouth, they develop fissuring of tongue. In addition to that, they also have joint pains. So the first case of the Sjogren, and when I have seen in the MD General Medicine, Lakshmi was the patient. She comes from Janagam, small village in near Janagam. She has dental caries, significant dental caries, and also significant joint pain. Generally, chocolate eating urban girl ko dental caries is okay, not for Lakshmi. And when I did the first time biopsy of the sublabial gland, we used to have one very nice rheumatologist by name Dr. Lisa. She looks just like you, Mithuna. You both will look like twins. I'll show you once. Lisa Rajshekar. Very dynamic professor of rheumatology. She did from PGH Chandigarh. So we had an opportunity, good fortune to work under tough teachers. Tough means not ordinary tough. Throw the case sheet if you don't write it properly. Kind of course, you are not that tough. So first time she taught how to do a labial biopsy. So then once more, those days postgraduates, we used to run to the pathology lab and see in the microscope. So that lymphocytic infiltration was shown by the pathology PG, right? So I can never forget the first time Sjogren's. And she has got a severe and serologically prevented with Sjogren's. Then we did she's also having tubulointerstitial pathology. So because the joint involvement, is it rheumatoid arthritis or is it Sjogren? Because rheumatoid arthritis, SLE, they also involve kidney. But generally they involve more glomerular, not tubular. Whereas Sjogren involves tubular also. That's a point you need to remember. Now, doctor. Normotension, hypokalemia, metabolic alkalosis. Where do you see? Normotension, that is a clue. Come on. Now Diksha is talking business. Very good. Barter's syndrome. I'm so happy I influenced. At least Diksha, 1% I could influence. So Barter, Little, Gittelman, Gordon. ये चार आप स्कोर NeetPG ऐप में जाके एक एक टाइप करे तो you'll get all MCQs and a discussion. Similarly, renal tubular acidosis type 1, type 2, sure short questions. All right, doctor. Now, extent of liver damage done by the chronic hepatitis B and C, how do you know? Only by liver biopsy. Clostridium difficile infection can be diagnosed only by sigmoidoscopy. Hepatitis virus progressing to chronic hepatitis most commonly is hepatitis C, not B, C. Fulminant hepatic failure, most common organism leading to it among the hepatitis infections? Yeah, मेरे भरत राले वाला अर्जुन आएगा देख लेगा. 2 questions you remember in exam, don't confuse. Pregnant women may fulminant hepatic failure most common with HEV. Pregnant women may. Overall, all are not pregnant. No, men are not pregnant, and about women all are not pregnant. So, but overall between HBV, HEV, which is more common? HBV. That's the reason overall most common cause of the fulminant hepatic failure बोले तो HBV होता. अगर pregnant women में बोले तो HEV होगा. That's what you need to remember. 16-year-old boy without pubertal development, secondary sexual character development, he cannot smell. Anosmia with hypogonadism means Kalman. Today, Diksha, you're the best. Come on, more of that. Kalman syndrome. So, low testosterone and normal LHRH response. So, there's a deficiency in secretion of LHRH from hypothalamus. They will respond if you give LHRH. In death due to starvation, what is the finding in gallbladder? If you starve, what make gallbladder to release its secretions? Distension of the gut with food. If food is not there in the gut, then gallbladder is not stimulated by, there is no release of cholecystokinin. So there is no stimulation of gallbladder. That's the reason gallbladder remains full. What is the age at which women can give valid consent for MTP under MTP Act? 18 years. 12 years for general physical examination. 16 years for sexual intercourse. 18 years for a consent of MTP. That means 16th year she can give consent for sexual intercourse, and consent for abortion will be given by mummy and daddy. Too much. Now, which insecticide is called plant penicillin? Endrin. Acrodynia, mercury poisoning, hyperpigmentation of palms and soles, arsenic poisoning, cognitive domain of learning is best achieved by lecturing, multipurpose. Whose cognitive? Teacher's cognitive. Domain will improve. Right? Even in midnight sleep, you tickle me, I will create a USMLE style MCQ and release. Right? I am as good as Chat GPT. Right? Chat GPT is so good. Hey, Chat GPT, create a MCQ on Bartter syndrome of USMLE style. Tuck, 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 tuck. It types along with explanation and gives. So it's so easy, you know. So मैं कल से हर एक घंटा 5-6 questions I'll keep dropping, and if Diksha, if you don't answer, you listen or don't listen, I don't care, but answer. Then I'll give a call. One call will come to your home, right? जप्टो में मैं भिजाता हूँ किसी को. जप्टो और डंजो. So one guy will come with helmet to your home. दीक्षा है क्या? उठाओ उनको. वहां से questions हैं. Why is she not answering? Or I will send a AI based robot which will come flying to your home, give an electric shock and go. So one of the students was asking, sir, I am 40. Can I get seat? At 50, I am still studying. So at 40, you should get seat fairly. Sir, one of the big challenges for me is reading a lot of content of so many coaching centers is mere bas mein nahi hai. I told, yes, by 40 we become presbyopic. And this much study material of 3,000 pages medicine doesn't make any way sense any part of our life. So our specialty is, can you be able to finish 30 pages में general medicine revision, 25 pages में surgery revision? That makes sense. So always keep the luggage low. You can do revision. Change of multi-purpose कौन ने शुरू किया? करतार सिंह कमिटी. Once more, a committee is called, doctor, some funny way you try to remember. Something or other you do, but remember. SPM was introduced by Bohr in our medical subjects. नाम भी बोर है, subject भी बोर है. Bohr committee. So daily water requirement for person is around 180 liters. It can double during NeetPG preparation. Permissible levels of fluorides in ppm in drinking water is 0.1 to 0.2. About normal standard deviation curve, One standard deviation includes, two standard is 95. For right skewed deviation, what is true? Median is smaller than mean. Which is a qualitative data को represent करने के लिए bar chart, spot chart, pie chart. Scatter is quantitative data के लिए. Number of malaria cases reported are being given to you. The epidemiologists want to find the average number that during the last 10 years. Best measure of average of this data is median. Why median? Because they're outliers. Very big value like 5,000, very less value like 160. We have Bharat like student, we have got Diksha like student. Kya karenge? Median is better. Right? Instead of when our outliers are there. Now, randomized trial comparing efficacy of two regimes, P less than 0.001. But in reality, two drugs do not differ in efficacy. What is this called? Alpha error means Agni Pariksha of Sita. Beta error is beta error of Duryodhan. यहाँ फर्क होने के बाद भी धृतराष्ट्र ने बोला फर्क नहीं है, मेरा बेटा बहुत अच्छा है. यहाँ सीता माता में कुछ भी दोष नहीं है, फिर भी उसको दोषी पुकारा. इसलिए अल्फा एरर होता है. When no error is there, you still consider an error. I mean, still consider there is a difference. Even though there is difference, you ignore it. That is type 2. Direct standardization is used to compare the mortality, especially when age distribution between two populations is different. Presuming the probability of the birth of a male or female is 0.5, gender of the newborn is determined randomly. So what is the probability of couple giving birth to all three male children? The pure mathematics question. According to Vinisha, no mathematics. ఇక్కడ పుకార్లు పుట్టి వినిషా అందరు వదిలేస్తారు. బయోకెమిస్ట్రీ అది కూడా బంద్ చేస్తారు. So it is 0.5 into 0.5 into 0.5 is 0.125. See, there are only two rules. Rule of addition, rule of multiplication. In this kind of scenarios, multiplication. So ये सब हमने biostatistics में खत्म किया. एक बार अरे sorry, I forgot. Now I'll add 1,500 questions in biochemistry, biostatistics with the discussion. Right? We'll add that so that you can just quickly revise that. So it's simple. You know, Vinisha, if you get depressed before NeetPG exam, the chance is 0.1. If you feel that your boyfriend is disturbing you, the chance is 0.1. And the chance that you are no more studying high yield topics means 0.1. If you don't attend Murli Bharadwaj coaching, another 0.1. If you do all the four, chance of your getting seat is 0.1 into 0.1 into 0.1. It will become 0.000001. That means if 100 years it takes you live, by the time you really crack NeetPG, it will be about 1 light year. So that's the reason try to keep cutting down the number of 0.1s. According to central birth and registration, event of death is required to be registered in. मरते ही 7 दिन में बोलना गवर्नमेंट को मर गया बोल के. हाँ, that's a very good mnemonic. 7 साल में अगर नहीं दिखाई तो मरने का नहीं मरा बोल के 7 दिन में मरने के बाद बोलना. And one more 7 is there. Tell me. 7-year itch in marriage. 7-year itch in marriage. Only until 7 years you will still consider whether your spouse is appreciating or not, or why he is fighting. After that, logical or illogical, you have to fight. Right? So all 7s, please don't forget. In pneumonia, due to mycoplasma. And next 35 days, if you don't read for more than 7 hours in a day also, consider that you don't get seat. So before 7 hours lapse is there, try to go back to the books and read 2-3 questions. So except myalgia, dry cough, pleuritic chest pain, bilateral infiltration of chest X-ray. ABG PH 7.2 means acidosis. PCO2 60 means respiratory. So it's the respiratory acidosis with a compensatory metabolic alkalosis because of the increase in bicarb reabsorption by the kidney. FeV1 by FVC is reduced in obstructive lung disease like asthma. Most common cause of empyema, bacterial pneumonia. यहाँ TB नहीं है, bacterial pneumonia. Most common of mediastinitis, esophageal rupture. Clubbing is never seen in bronchogenic carcinoma. Sorry, in small cell carcinoma. Squamous lo untadi, small cell lo undadu. Agreed? Why? Small cell carcinoma का very popular problem क्या है? Notorious problem. छोटू इधर उधर भागेगा जल्दी. So by the time you diagnose, only metastasis is there. टाइम कहाँ है क्लबिंग बढ़ने का, तब तक आप मर गए. तो इसलिए सर्जरी का रोल किस में होता है? स्क्वेमस सेल कार्सिनोमा में सर्जरी कर सकते. यहां क्या करोगे? स्मॉल सेल तो पूरा बदन में फैला हुआ है, राइट? हाँ. सीरम एस इज raised in sarcoidosis, silicosis, and even berylliosis. Why? All these are granulomatous conditions. Granulomas release vitamin D like substance and also angiotensin converting enzyme. Cryptogenic fibrosing alveolitis. Then as Bambishnava, nurses. Decreased lung capacity, diffusing capacity, decreased alveolar oxygen tension, all the three. Whenever you have restrictive lung disease. So now, doctor, absent seizures. EEG में क्या होता है? 3 Hz spike and wave pattern. The only thrombolytic approved for acute ischemic stroke is TPA, tissue plasminogen activator. And TPA should be used within 3 hours. Is stroke and brain lama, gundala vadu. Ayyo. Nu mari red bus digino stroke ante heart attack కదా సార్ అన్నట్టు ఎట్లా చెప్పు గిరీషా. Lacunar infarct is caused by lipohyalinosis of penetrating arteries. In right middle cerebral artery infarct, what do you see? Hemiparesis, facial weakness, dysarthria. Aphasia कब होता है? Right handed person is में left side dominant. So unless left middle cerebral artery is involved, aphasia is not a feature. Transtentorial uncal herniation में क्या होता है? Transtentorial uncal herniation में contralateral dilated people रहता है, ipsilateral नहीं रहता. See, this is calvarium. When the temporal lobe uncus herniates now, so what it will do? It will cause an increased pressure and pushes the brain to opposite side. There you have the oculomotor, which is compressed. That lead to dilated pupil contralaterally. That is a false localizing sign. Whereas this lead to decorticate rigidity because uncal herniation cause the compression of the midbrain. So above the when do you call decorticate, when do you call decerebrate, ఇవన్నీ కూడా న్యూరాలజీలో చర్చించాం అధ్యక్ష, జర చదవాలి మీరు. The lesion in the inferior frontal gyrus causes motor aphasia, Broca's speech area. Normal pressure hydrocephalus में क्या होता? फटाफट बोलो दीक्षा. दीक्षा only is going to answer this. Come on. मैं बहुत बार बोला इसको. ना एसी ऑब्जेक्ट. हाँ, AC off chamber. बोलो डॉक्टर. What is triad of normal pressure hydrocephalus? Huh? Ataxia? ఎఫేజియా ఎందుకు ఉంటుందప్ప? యూరినరీ ఇన్కాంటినెన్స్, గైట్ డిజార్డర్ అండ్ డిమెన్షియా. నార్మల్ ప్రెషర్ హైడ్రోకాఫ్లస్ ఉంటాయి కదా. యువర్ ఫ్రంటల్ లోబ్ కంట్రోల్స్ వాట్? వాలంటరీ కంట్రోల్ ఆఫ్ ద బ్లాడర్. So the expansion of the ventricles will cause the compression of those descending fibers of the frontal lobe, which are the supraspinal control of bladder, that lead to urinary incontinence. Same time, gait disorder and dementia. What is the biggest problem to make a diagnosis of this? Any elderly man, if urinary incontinence is there, they think prostate problem. When they have dementia, बड़ा हो गया इसलिए बुला हुआ है, और gait disorder, arthritis है ना इसलिए बोल के. But intelligent Diksha will think gait disorder, urinary incontinence, dementia. Chat GPT, what is the diagnosis? Chat GPT will say normal pressure hydrocephalus. Okay, you remember this. Painless burn hand is characteristic of Didyapale. The colonel who smokes cigar, typically burning the front of the chest, nape of the neck. Huh? Abba. Very good. Characteristic finding of CT in TBM. There is a basal exudates, very characteristic. That's the reason basal part of the brain may kya hota, all cranial nerves come out, no? That's the reason whenever TBM is there, unless you start dexamethasone, steroid, the basal exudates will cause the cranial nerve compression, deafness aata kabhi kabhi. So you need to be careful. Which porphyria has cutaneous manifestations like angioedema? Mala idoti. Porphyria, sure short question, doctor. Don't tell examiner porphyria, भूल गया. Porphyria पढ़ के जाना. Erythropoietic porphyria. Familial hypercalcemic hypocalciuria. That means kidney is not excreting calcium, so calcium in the blood is increased. So typically there is an increased calcium at birth. Autosomal dominant inheritance, it is due to mutation of the calcium sensor. If that is mutant, what will happen? It doesn't know, and it keep on recovering the calcium, and that lead to hypercalcemia. There is a low urinary calcium excretion associated with familial hypercalcemic hypocalciuria. That's the reason calcium by creatinine ratio, if you take, because there is a low calcium, it is less than 0.01. Polyglandular autoimmune syndrome type 1, what is accept about it? There is a hypoparathyroidism, metal insufficiency, mucocutaneous candidiasis, vitiligo, pernicious anemia, they are all called as PGA. But type 1 PGA is AR, autosomal recessive pattern of inheritance. So very nice to see. Pavan Kumar, very good. Pavan gives a very good mnemonic. Wet, wobbly, walkie. Wet, urinary incontinence. Wobbly, ataxia of gait. Walkie. I mean, difficulty in gait is walkie, and wobbly, dementia. Good, good. Very nice. Pavan, people like you are the need of the hour here because we have a very short retention, right? Good. Am I going slow? Mr. President, what do you say? So, doctor, now, what are the causes of chronic hypocalcemia? Whenever CRF, vitamin D deficiency, or hypoparathyroidism, they're all synonymous. Whereas hypomagnesemia is associated with hypocalcemia, not hyper. So these are all causes of hypomagnesemia. Barter, Gitelman, refeeding. In all the three, magnesium falls, not lithium intoxication. So, you should know that lithium intoxication lead to hypermagnesemia, not hypo. So once more, what is the rule of NeetPG exam? Hyper, hypo. Calcemia, magnesemia, sodium, potassium. ECG में क्या होता, causes क्या होता, everything you need to play with them. One question electrolytes आएगा. So what is the manifestation of hemochromatosis? Arthritis, skin pigmentation, and diabetes. Okay, earliest manifestation means hepatomegaly. Okay. It's also called bronze diabetes, hemochromatosis. The best test to differentiate pituitary microadenoma from ectopic ACTH as a cause of Cushing. You do petrosal venous sampling selectively. What will it identify? Pituitary microadenoma అయితే హై ఉంటుంది, ectopic ACTH అయితే హై ఉండదు. ectopic बाहर से तैयार हो रहे ना, पिट्यूटरी में नहीं तैयार हो रहे ना. సో డాక్టర్ కుషింగ్ సిండ్రోమ్ కొట్టాలి మీరు పంచ్. స్కోర్ NeetPG యాప్లో సెర్చ్లో. Then ethanol induced hypoglycemia. Why? Because ज़्यादा दारू पिए तो ग्लूकोनियोजेनेसिस बंद हो जाएगा. काइकू ethanol become acetaldehyde release acetyl CoA. What is the effect of acetyl CoA? It blocks the gluconeogenesis. Why? How acetyl CoA block gluconeogenesis? Typically, from where is acetyl CoA formed? From pyruvate. From where is pyruvate formed? From glucose. If glucose is abundant, pyruvate is abundant, then acetyl CoA is abundant. So whenever acetyl CoA is abundant, body will think glucose is abundant and it does not lead to gluconeogenesis. That is the reason there is hypoglycemia. Right? I still remember giving this explanation. Spot think karke in biochemistry bios. Our examiner, one very old man, Dr. Das. Where did you read this? He asked. It's common sense, sir, I said. He lost his nerve, when I said, that means he doesn't have, I have. Then the next statement he said was, he's the hypertensive guy, Dr. Das. Do you know how many times I read Harper? How many times, sir? 38 times. Yes, sir. Do you know how many times I read Stryer, Lubert Stryer? How many times, sir? 40 times. Now you should know to whom you are talking. Then I said, I used to be very cranky in those days. So you take so many times to master them. I just read only one set, but I know that is the underlying cause, sir. I can show you in the Stryer, which I never read. So that man lost. I just got 51 marks in biochem, 51% in biochemistry. Bar bach gaya. So good. You are reminding me about the Daru and Mr. Das. Now, doctor, ACEP. Very good. NCEP ATP 3 guidelines set LDLC goal as what? Less than 160 for normal individuals, less than 130 for individuals with 2 or more risk factors, less than 100 for people who already have risk factors like diabetes. If you don't know cholesterol targets and ये जिंदगी बेकार है MBBS बन के, क्योंकि of course nowadays chat GPT you can ask, right? No big deal. So which is extraintestinal manifestations of IBD that does not correlate with bowel activity? Psoriasis does not, but arthritis, pyoderma, gangrenosum and erythema nodosum do. They're all the extraintestinal manifestations of inflammatory bowel disease. IBD and irritable kaada kya? IBD and irritable bowel. No, I mean, there are some students who used, sir, irritable bowel syndrome, how will all these skip lesions, everything, how did you think it is irritable? No, sir, you are saying IBD. No. నేను ముందే చెప్తే అయిపోయేది కదా. So no problem. I had lot of flashbacks with thousands of students sitting like you, right? No problem. So detection of HBV in window period is by IgM anti-HBC. What did I tell you? Hepatitis B virus serology nahi पढ़ के गए तो दादाजी नाराज हो जाएगा. NeetPG दादाजी. Chances of becoming HBV carrier after hepatitis B is increased by neonates, Down syndrome, patients on especially hemodialysis. Pregnancy has no relation. So Down syndrome, lymphoproliferative disease, HIV, and those on hemodialysis are more likely to become chronic carriers. By age 4 months, most infants will have a developmental milestone, escoma, right? So good. Good to see Ultron. अरे आपका असली नाम लगाओ यार, हम प्यार से बुलाएंगे आपको. So by age of 4 months, most infants have all the following except by the age of 4 months can roll over, conjugate eye movements. They do not sit with support until the age of 5, do not have incisor teeth until 5 to 7 months. Then which is the developmental attainment appropriate for 10-month-old child? He has symmetrical forward parachute reaction, he can jump on any other girl. So then 90% of children at 1 year would do all this except they show stranger anxiety, go up a toy on request, has well-developed pincer grasp, which is typical of an obese 8-year-old boy. Obese 8-year-old. Obesity tends to lead to accelerated growth, including height, bone age, and puberty. But very early fusion of ossification, and ultimately they become shorter. So what is wrong about measles vaccine, doctor? It results protection that lasts about how many years? 5 or 8? Shouldn't it? It is effective when given simultaneously with other immunizing agents, more likely to produce protection at the age of 15 months than at 9 months because of the interference with the maternal antibodies. It is effective for up to 5 years, at least 5 years. Intussusception in a child may be initiated by Meckel's diverticulum in children. In adults may any lipoma, intestinal lipoma can be leading Meckel's, can be leading one. Treatment of central umbilical hernia is reassurance to the mother, 4-month-old baby may. Majority of umbilical hernias resolve spontaneously. Only if it is persisting beyond 2 years, it requires operation. In acute bronchiolitis, the lung volume is high because bronchiolitis, just like asthma, will cause air trapping, leading to increased lung volume is what you need to remember. What is wrong about right ventricular hypertrophy in children? भैया ट्राइकस्पिड एट्रीसिया में क्या होता है? The blood is not coming to right atrium to right ventricle only. So when right ventricle has no job, why will it hypertrophy? Similarly, what is the other rule? Whenever it is a pure MS, never LV hypertrophy or LV dilatation will be there and cardiac size will be normal. Huh? AS lo untadi, barabar untadi. Undadu, pure MS may. But if the MS is associated with MR, or if the MS is associated with AS, or if the MS is associated with AR, any of them can cause the cardiac chamber size to increase. And what is uncomplicated patent ductus arteriosus in a 2-year-old child? It will cause an increase in vascular markings. Why? Because if the PDA is there, the high pressured aorta will push the blood into pulmonary artery and that leads to pulmonary plethora. Tin tag sign is seen in DLE. Tin tag को क्या बोलते हैं? Cat's tongue sign, carpet tag sign है. In DLE, discoid lupus, well-defined erythematous plaques with partially adherent scales entering a patulous follicle, and when you remove the scale, its undersurface will show horny plaques that have occupied follicles, which is called carpet track sign. Best prognosis, neonatal type of pemphigus may best prognosis. It is caused by transplacental transfer of IgG antibodies against the desmosomes. मेरे प्यारे भारतवासियों, 9:11 हो गया, 100 तक बंद करेंगे, ठीक है? So, but please study, be high in energy, no poker face, high in energy, be cheerful at heart. अगर आपको क्या करें तो हैप्पीनेस मिलेगा बताओ, मैं I'll bring it from the moon and give you, but be happy. क्यों? Because you are with Dr. Murli Bharadwaj, right? I have lifted the people who did not qualify in many entrance exams but ultimately gone to become DGO, MD, Gynops, Radiology, MRCP. If you want, I'll call all my past students. They'll talk tons about me. Array, this maniac who pumps tons of optimism, incurable optimism into you is that's the most important thing, doctor. The worst thing we can ever do is to rob somebody's hope. And the best thing we can is to spring it. Understand? Good. At least yawning is very encouraging. Right? So, good. So now, doctor, which is not seen in herpes gestationalis, tense bulla, periumbilical lesions, linear C3 basement membrane zone staining. So herpes gestational also called pemphigoid gestationalis. So there are subepidermal blistering lesions, linear C3 deposition occur. And it has nothing to do with नाम तो है herpes gestationalis मगर herpes से कुछ भी लेन देन नहीं है उसका. ठीक है? Now, what is a strong risk factor for plaque psoriasis, doctor? HLA-CW6. What is the most characteristic of nail psoriasis, doctor? Oil drop sign. If the tracheal tube can't be advanced to the trachea, which maneuver can be helpful? Elevation of the mandible, applying external pressure, withdrawing the tube and turning it 180 degrees. But see, simple rule, doctor. Endotracheal intubation में अगर वो by mistake esophagus में गया, टेंशन कुछ भी नहीं है. और एक ट्यूब दे दो. अभी कहाँ जाएगा वो? अगर यूरिथ्रा में नहीं जाए तो वेजाना में जाएगा, वेजाना में गए तो यूरिथ्रा में जाएगा. सिंपल. उस पर टेंशन क्या को? So put another tube and then remove the first tube. First tube is like your rail tube because it has gone into esophagus. मगर आप confusion में वो first tube अरे ये esophagus में गया बोल के tension में उसको निकाले तो full secretions come out and he will aspirate. भगवान ने खाली stroke दिया, आपने aspiration दिया. किसके वजह से मर जाएगा? आपके दिए हुए aspiration से मर जाएगा. So then while dying, he'll say, what a high aspiration, doctor. Then the maximum depression cardiac output, halothane. Asthmatics may agent of choice, halothane. Which is not metabolized in liver, N2O is not. Ether, cyclopropane, desflurane, everything. Highest post-operative nausea, vomiting, PON-V is caused by ether. Ether is very easy to administer, but ether lead to nausea, vomiting. जरा पागलपन भी खत्म करके जाएंगे, psychiatry भी. Dusky purplish cast to the face with telangiectasis, pathognomonic cough. Don't look at me, alcohol abuse, right? You did not tell Vinisha. सर आपको देख के तो ही समझ में आ रहे कितना बोतल खत्म हो गया. So alcoholic abuse. According to Friedman, Roseman, type A behavior means career oriented, hard driving, no boyfriends, no girlfriends, same sex, opposite sex also. Nothing is only studying, getting distinction score is type A. The other one is type B. Type B क्या सोचते हैं? मुकेश की गाना सुनो, पूरा बुक वहां रखो, बुक ऑटोमेटिकली मेरे दिमाग के अंदर आएगा. मैं बुक के पास क्यों जाऊं? गालिब का शायरी सुनते हुए knowledge comes to my mind rather than I go to the knowledge. So Sparrow app, Marrow app, कैरो ऐप, सारे ऐप्स को खरीद के रखो, वो आके मेरे दिल और दिमाग में घुस जाएगा। अगर कोई ऐसा सोचे तो टाइप भी है, राइट? सो टाइप ए मीन्स, oh, Murli Bharadwaj sir offers for only 2,000 rupees, huh? Okay, sir, can you offer it in 5-year EMI option available? आनंद क्या बोला मालूम? सर आपका आपका जरूरत क्या है सर? नोट्स दिया, वो पढ़ रहा हूँ, वेरी स्मॉल नोट्स। तो ऐप कई को ऐप कुछ भी यूज नहीं है क्या? नहीं, मेरे अंदर एक शेरनी है, वो शेरनी बहुत दिनों के पहले सो गया, उसको उठाने के लिए मैं कभी कभी आपका टेस्ट करता हूं, मगर खाना तो शेरनी के जैसे ये स्टडी मटेरियल खत्म करता हूं। जिराक्स पैसा कितना होता है बोलो, उतना देता हूं। 1200 pages, okay, 1200 into 30 paisa is equal to 360 rupees. So that is the valuation. Good. Being impatient, ambitious planning. मैं 20 hours पढ़ूंगा वो सब, Echolalia is a feature of autism, Alzheimer's, catatonic schizophrenia. So if you have echolalic patient, never compliment the nurse. Hey, Nurse Mary, you look very beautiful. The whole ward will be talking, hey, Nurse Mary, you are very beautiful. Right? So delusions may be seen. Okay. Delusions may be seen in which conditions? Mania, schizophrenia, dementia, in all these things. So what is rabbit syndrome? What is rabbit syndrome? It is a fine, rapid, repetitive movement of the lips is called rabbit syndrome. So what is meant by akathisia? Irresistible urge to move around. Automatism, performance of non-reflex acts without conscious volition, like reading the 3,000 pages of medicine. Non-reflex act without underline, automatism. Mannerism, exaggeration of a style or action is called mannerism. Chalo. So thank you very much for all of you. And those students who are new to this session, please let me tell you, just pay 2,000 rupees. You get the Score NeetPG app, subscription. You have 100 full-scale grant tests with daily discussion, 40,000 MCQ question bank, 1,200 pages notes, and 600 hours video, everything. So tomorrow we'll try to conduct the session afternoon. So పొద్దునే రండి, కూర్చొని చదవండి హ్యాపీగా. 38 days and you had been attending almost 1.5 months. You have properly sat on the orbit to be a satellite. So abhi kya hai na, 30-35 days mein don't let any guilt come, no comparison with anybody. Baito pado, zyada tension aaye to jara ro. I'll arrange one pillow. That's what we'll call crying room, praying room, crying room. जाओ, put your head in the pillow और थोड़ी देर के लिए you cry, then wash face. I'll arrange a nice cup of coffee. Baito pado. So morning 10 to 8, if you are in the learning center, you will get seat. Next 35 days. That's my promise to all of you.